So the next thing that we're going to talk about is what we call a pullback or even a takeaway close. And so this is in a situation where maybe somebody's being a little resistant. They're throwing some objections at you, and certainly you can try to handle those objections. You can answer those questions. But a pullback, also known as a takeaway, is where you actually really kind of say, "Hey, in this particular instance, I'm not sure if this is the right product for you." Maybe someone asked you a question and you know that we haven't even been through the process, and they say, well, I don't know if I don't know if this index strategy is right for me, or I don't know if life insurance is right for me, or whatever it is they're saying. I don't know if an annuity is right for me. Being able to right then and there say, well, you're right, Mr. Mrs. Client. I don't know if this is right for you. It may not be right for you. But what I'd like to do is go through a little more discovery, and I can learn a little bit more about what you're trying to accomplish and your goals and your risk tolerances. And then I'll make a recommendation. And then from there, you can make an educated decision to see if this is something that's right for you. And so that is going to, the takeaway in some cases is going to help you move the process forward. Now let's talk about it maybe even at the end. You have gotten to the end, you've gone through the full process, you've made a recommendation, and someone still isn't in a position where they want to make a decision, and they're giving you that, I'm just not sure that this is right for me, or some type of objection like that. The way that you can utilize this in that particular scenario would be, well, Mr. Mrs. Client, to be honest, I'm not sure that this is the right product for you, because there are some things that are very important. If you were going to utilize a product like some type of index strategy, you do have to fund it properly, and so if this is something that financially you can't afford, that's okay. We do have some other options, but this might not be the right product for you. Or maybe we're in a conversation of term versus permanent coverage. In that particular situation, maybe if someone's trying to decide between the two, listen, permanent sometimes will cost a little more. And so I'm not sure that one's going to be right for you, because I'm just not sure that it's going to be in the budget based on some of the things that you told me and some of the concerns you have. And that person's going to react one of two ways. They're either going to go, yeah, you're right, it's really not in the budget, I think maybe we should go this route over here. Or they might react with a little bit of pride and say, no, I've got the budget for that. You're right, no, I can afford that. And so I want to move forward with that permanent coverage, or I want to move forward with this particular product, or whatever it is. And so using the takeaway in some cases is going to allow you to not look so desperate for a sale, not look so hungry, and also not look overly eager to where you're just trying to push someone into something. Because if your client feels that you're just trying to push them into something, and you're just trying to push it across the finish line, a lot of times you'll get that little bit of resistance, because they get a little unsure as to why you're pushing this thing so hard forward, and maybe they haven't received enough information to make an educated decision yet. And so having that takeaway gives you the opportunity to say, I tell you what, let's put this on the side for now. I'm not sure this is the right product for you, or I'm not sure this is the right strategy for you. I've got a few more questions. I'd love to dig in a little bit and just make sure that this is the right product for you. And then that lets them know that you're not just trying to just push them into something. You really are going to take the time as an educated financial professional to comb through, answer all their questions, make sure that they feel comfortable with the recommendation, and then knowing that you were willing to take that away and pull that off the table is going to put you in a position of power rather than a position of desperation. And you always want to be from that position of, hey, I've got something really great to offer you. I know it's good for you, and here's why, and let's talk about how it works and the intricacies. And this is my recommendation. I'm the doctor, you're the patient. I'm giving you my diagnosis and my prescription, and that's kind of the overall feel. So don't be afraid to kind of pull back on that. If you're overeager, that will give off red flags. And so use the takeaway in your various conversations as necessary. And we're excited for you to institute these psychology tips into your overall process in helping people move through a process and make decisions.